This is Group 27, consisting of Jeffrey, Jessica, and Carmen. Our topic is harmonic imaging with ultrasound and the technology, issues, and application of it. Fundamental echoes must pass through the body twice, whereas harmonic originates in the body, and therefore are less subject to distortion from non-linear propagation. This technique was discovered by scientists in the USA while working on the development of echocardiography. They found a tissue image was still created when the receiver was tuned to receive twice the amount of transmitted frequency. This meant harmonic frequencies arose even without the injection of microbubble contrast agent. In fact, some of the features of the image were superior to the original image. Harmonics are multiples of the fundamental frequency, hence transmitting a frequency of 3 MHz will result in production of harmonic frequencies at 6 MHz, 9 MHz, 12 MHz, etc. There are two different processes that can be utilized to create harmonic signal. First, by using filters to screen out the fundamental from the noise in harmonic echoes. Second, by using two simultaneous poles with a 100 degrees angle difference. Harmonic image can involve injection of contrast agents with the appropriate microbubbles, then scanning the region of interest at a given transmitted frequency and tuning the receiver to receive double the amount. The advantages of these techniques are improved axial resolution, better lateral resolution, decrease in noise from side lobes, improved signal-to-noise ratio and reduced artifacts, improved range penetration, and better contrast resolution. The disadvantages are less penetration, more shadowing, and can confuse with respect to possible calculi. Ultrasound has been used since the late 1960s to diagnose pregnancy. Fetal scanning is now one of the most common applications of harmonic ultrasound, as it can diagnose pregnancy safely and early in the trimester. Tissue harmonic imaging has been used in clinical investigation of pregnancy-related things, such as fetus abnormalities, genetic syndromes, placenta locating, and maternal pelvic structures, as well as other clinical settings such as breast tissue abnormalities, axillary lymph node, hepatobiliary, pancreatic, renal, genitourinary, and pediatric. THI can differentiate between small anatomical structures, such as abnormal tissue, portal veins, small biliary branches, and lesions, clearly in high fat dense tissue and fluids, which includes cysts and fluid built-up areas. This is helpful for newborn and toddlers since they have such a small body. A fundamental frequency image with a higher frequency will be more effective. THI technology are now a basic necessity in hospitals as it is used in various clinical investigation, allowing important diagnosis, thus improving the quality of life of a patient born or have not been born yet. There's a case study comparing the use of THI to conventional sonography. The aim was to determine if THI or conventional sonography would produce a better image and reduce the availability in the intima media thickness measurements in the common carotid artery. The result from this experiment shows that THI has a 51% rate of high image quality compared to the 32% for sonography. The case study shows that THI produced a higher image quality compared to the sonography in the carotid artery, IMT. A significant reduction in the intra and inter-observer variability in the IMT measurements. Clinical effects for harmonic imaging. THI shows a great clarity than conventional sonography in pathology and normal structure parts. A good image obtained effortlessly. Easier to scan technically difficult patients. Faster scan time. Tissues harmonic imaging are more effective in renal imaging due to the considerable distortion related to the body wall for that area. Many cases shows THI can diagnose the renal cell carcinoma and kidney stone, which conventional sonography cannot do. This prevents patients from spending extra money on other scans. Overall, harmonic tissue imaging is a very useful modality in diagnostic ultrasound and is available everywhere, ranging from handheld all the way to the high-end radiology.